Hello, everybody. My name is Joshua Smith. It is about 2 p.m. Eastern Time, so we are going to be starting this webinar today. I'm one of the regional sales managers over here at Neishloss and Fleming. I want to thank you all very much for attending today's webinar. My goal for today is to take about 15 to 20 minutes or so to teach you about how to use Medicare.gov while you're either in the field on an appointment or even in preparation for an appointment. For a little background on me, I've been working at Neishloss for almost 3 years now, and the majority of that time has been in my current position and role as sales manager for Team North. Team North is a little bit of a strange name as it does not include the New England states, North Pennsylvania, but every other northern state from Ohio and west that's above Tennessee is what I oversee. So yeah, that can be a lot, but if it isn't necessarily your area, then that's okay because Medicare.gov is able to facilitate all questions from every state. And if you have any questions, obviously you can feel free to reach out to me or the appropriate sales manager for your territory. We're all happy to help you out. If you're joining here with us live on the webinar, I want to make sure that you guys know that I can see your questions and I will be getting to those more towards the end, so thank you so much for being able to participate with this. And then again, I'll get to all the questions here at the end of the seminar. All right, so as we all know, the folks aging into Medicare are becoming a lot more tech-savvy every year. Just think about all the seniors that are aging into Medicare today. Yes, all 10,000 of them. How many of them do you think are connecting to their friends, families, or neighbors on, let's say, Facebook? How many of them are starting to get their news online? How many use email? Although it might not be all the seniors you're talking to that are becoming a little bit more tech-savvy, I'm sure that you can agree that the number that embrace technology this year is a lot higher than some of the years previous, which is going to be more than last year and the year before that and so on and so forth. So if you don't start to capitalize on this market, I'd hate for you guys to start finding yourself having to play catch-up with all the other agents that are out there that are using these online tools and resources to not only educate themselves, but also educating their clients. Medicare.com is going to be one of those resources for you. Here on the slide, we have a general screenshot of Medicare.gov. And if my internet is actually cooperating today, I'll get a chance to go to the website itself to show you around. But for now, let's just take a quick look at some of the best features of the website and why they're so important. First of all, this is going to be one of the most important websites that any senior could ever use as they start thinking about retirement and becoming eligible for Medicare. It's an all-encompassing website that offers a robust support and guidance for anyone looking for information on what to expect, how to plan, and how to take your very first steps. In addition to the usefulness on the client side, it also plays a vital tool for every independent insurance agent out there. So whether you're in a home or prepping for an upcoming appointment, you can use this website to quickly find general Medicare information like election periods for Medicare Advantage, Medicare supplements and prescription drug plans. And you can even dive in deeper to look at plan-specific information. The website also includes blogs to build your knowledge base, important appeals and enrollment forms, and even includes some HIPAA approval forms as well. And of course, some of the most important tools on the website are the plan lookup and cost anticipations. You can use the site to do side-by-side comparisons of any Medicare Advantage or prescription drug plan. They also have a complete list available of Medicare supplement plans, but keep in mind that those don't show the side-by-side comparison costs. For that, we actually recommend just checking out the quote engine on our website, nnfinc.com. pre-appointment and finding the right plan. So whether you're researching pre-appointment or if you're across the kitchen table, you want to find the plan that best fits your client's needs. In the Find Health and Drug Plans option, which is circled on the screen, you'll be able to identify the best Medicare Advantage and prescription drug plans for all of your clients. The website will only ask you a few questions such as your zip code, what type of current coverage the client has, and income status like supplemental income or extra government assistance. If your client is on one drug or if your client's on 25 different drugs, you're able to upload all that information to the system and even save it under their own user ID for any future changes. Like how I mentioned as well, there's a ton of great customization options. These options allow you to narrow down your search by monthly premium, drug deductible amount, star ratings, special needs plans, and even to narrow down to specific companies. And that last bit is really crucial, especially if you have an area that is hyperinflated with plan availability. We all know that if you give someone too many choices, that they'll end up confused and unable to make a decision. So to combat that, that's why, again, it's so crucial to come to your appointment prepared with a couple of front-running options and to know the carriers that the consumer might be accustomed to. That way you can offer the best and most comfortable plans tailored to their specific needs. And once you figure out your drugs and plan types, you'll eventually land on the results. On the results section, you are going to find what the anticipated cost of original Medicare would be. For this slide, you can see that I generated a quick quote for a Pittsburgh zip code. Below the original Medicare section are your plan results. These are organized by plan types and are initially sorted by lowest estimated cost. Do know that the costs displayed are, again, estimates, and your costs are going to vary. And for Medicare Advantage, you can almost disregard these entirely because you can really never plan how often your client will be going to the doctor or if they need surgeries during the year. There are some selections that say when you're going through the list, if you can select if you are looking for quotes for someone who's not healthy, who is of good health, or is of excellent health. But those are the only really three defining factors. So again, it's not going to be able to tell you the whole story because you're not actually sitting down with your client one-on-one and going over how many times are you going to the doctor, or how many surgeries you have planned upcoming, or what has your previous history been with going to the hospital. So again, you're really not going to have a good idea of what the Medicare Advantage previews are going to look like. That's why it's always really great to use the features that are built in, like monthly premium or inpatient hospital copays. Those are mostly going to be stagnant costs and something that you're able to quote for that. Prescription drug plans, on the other hand, they have a much better estimation because your client's already on those particular drugs, and you can anticipate those costs month by month. And the only thing that would change with that is if you are going to be really picking up any new prescriptions. Or if you're taking some away, then it's just going to save you some money in the long run anyway. All the plans have a comparison of estimated annual drug cost, monthly premium, deductibles, health benefits, and star ratings, aka just about all the information that your clients are going to be needing and asking about. Additionally, you can compare up to 3 different plans using the checkboxes and selecting the Compare Plans option. And again, I'll get into that a little bit later once I go to the live demonstration. A quick word to the whys on using this with your clients, and it is, again, the last thing that you want to do is confuse them with an overabundance of choice. You're the agent, you know the plans in your area and which ones are the top competitors. Use that knowledge with any carrier preference that the client may have, so you should already know and you should show them that custom tailor-made options for their specific needs instead of showing them, again, everything under the sun. Above and beyond. So outside of just looking at plan availabilities on the website, you can really go the extra mile for both yourself and your clients. For instance, one of the marketing tactics that we use here a lot involves speaking with individuals sometimes months before their initial enrollment period. This means that sometimes we need to walk these clients through some of the initial steps of getting on Original Medicare A and B. And instead of having the client go down to the Social Security office or even call in, you can actually sign them up for Medicare in less than 10 minutes right here on the website. If you have questions on Medicaid, state Medicare savings programs, PACE, low-income subsidies, or supplemental security income, all of that information and more can be found right here on Medicare.gov. So you're going to want to do yourself and all of your clients a favor and check into these programs. It's one of the best things that you can do, and one of the top reasons a client is willing to come back to you as an agent is going to be when you're saving them money. And you can even show a little initiative of yourself when you're sitting down with some of your older clients with ratty cards. Have you ever noticed the client's Medicare card might be on their last legs? Help them out. Order a replacement card from their Social Security account right here from the website. Or if they change, move, update address, direct them or walk them through Medicare.gov to have them order a new Medicare card right for them. And then finally, you want to make sure that you're keeping yourself and your clients up to date with the latest phone numbers, websites, blogs, and podcasts that are all available for no cost on the website. So that kind of goes over what I was hoping to show you guys, or at least preview you all for the Medicare.gov. Now we're going to get into a little bit of the live demonstration. So bear with me if I am going to exit out of that real quick and head to Medicare.gov. So the first thing that you're going to see when you go to Medicare.gov is something that we've already seen on the slides itself. You've got the main web screen right here. You've got your MyMedicare.gov login, and I kind of want to point that out for just a quick second here to show you how easy that it is to sign up and register. Once you've already registered, you're new to Medicare.gov, you can go ahead and create an account. You'll use that information to create a username and password. So you'll need like a Medicare number, you'll have your first name, last name, gender, and zip code, and then you're well on your way to starting your own Medicare.gov login. However, you don't necessarily need that. That's more if you are going to be using this website often and want to save some of your custom information that you're entering into the system. But for now, we're not going to use that login, but I'll show you a few of the other features that's available. So one of the first things that we're going to notice are the tabs near the top. So these are going to be for your general Medicare questions. So questions about signing up and changing plans. You'll have a whole drop-down of information that you're going to be able to click on and get additional information for. So getting started with Medicare, your Medicare costs and choices, find health and drug plans, checking on your current enrollment. If you go to Medicare costs, you're going to see the 2017 updated costs for Part A, Part B, and drug coverage. What Medicare covers. Have you ever asked or have you ever been asked by a client, hey, what does Part A cover? What does Part B cover? Will this service be covered under A or this service be covered under B? These tools and resources are right at your fingertips, so you don't have to waste time maybe calling up the carrier and asking specific questions like that when you can find what Medicare Part A and B is already covering for you. Drug coverage, Part D, how to get drug coverage, costs for it, when did you join drug plans. Again, one of the best tools for this is if you're ever in like an SEP, special election period opportunity, that you want to just make sure that you're enrolling someone into the right plan at the right time. It'll give you the outlines of how many days after someone drops their current coverage are they able to have an open election season, or if their coverage drops them, how long do you have? Once you turn 65, what's your options? Are you just enrolled into Part B? What are your options? All of that information and more can be found on here. If you ever have questions that maybe you're just, if you're highlighting over these sections and you're not seeing exactly what you want, go ahead and use the search function. Type in, Medicare Advantage if you're looking for like election periods. If you're looking for disenrollment or special needs, start typing up here because they'll pre-populate all of the information that you're probably going to be looking for. So if we want to see Medicare Advantage disenrollment, we want to have topics about that, just click or type in the appropriate search term, click the search button, and then you're going to find a whole host of Medicare.gov links that will take you to all the different pages on the website to cater to those specific needs. So that way, again, it's going to be more likely to prepare you for any sort of appointment. Do some fact checking. Find out where your client is right now before you go on an appointment, and just make sure that you have the right idea and what you can offer them at what time by checking out their current situation on Medicare.gov and doing a little bit of extra research on that. For finding services that are covered, we can always use this to type in that current service or test item, whatever it needs to be. If you want to make sure that it's covered under Medicare, type whatever service that is in there and click go. You can find your health and drug plans like we're going to do in a minute and actually be able to compare some of the local plans in a particular zip code. You'll be able to scroll down here for blogs, news, and videos. So these are just tools and resources for you and the clients to utilize and get more familiar with the Medicare market as a whole and be able to make sure that you're as knowledgeable as possible with anything that does come your way. So with videos, news, and blogs, again, all really great tools and resources for you to utilize. On the left, we can see if we can find doctors, providers, and hospital plans for suppliers, being able to search for those as well. It's not going to be as accurate or up to date probably as if you're looking to put someone on a specific plan like an Aetna or Coventry or United Healthcare plan. Obviously, you want to find out those doctors or hospitals are going to be in network on those websites. But this is just kind of like for generic or general Medicare coverages. Then on the right-hand side, too, we can get help with costs, find out how Medicare works with other insurance. Go paperless, get all sorts of great documents online at no cost. All you got to do is just download them. Makes it a lot easier than getting like mail and stacks of paper delivered to your door, or those Medicare Made Clear books. Although those are useful, you can have online options available to you to download. So what I'm going to do now is we're actually going to use the Medicare Plan Finder. So we want to find health and drug plans. So I'm just going to show you a quick preview of how that all works and how you can kind of see a side-by-side comparison. So all you got to do is just click that particular link from the screen there. And then you're going to have a couple of options. If you have the individual's information, I 100% would recommend you using the personalized search, using their zip code, Medicare number, last name, and effective date and date of birth. Put all that information in there. You're going to be able to find those customized plans. But for the sake of ease, for right now, let's just go ahead and type in a general search. And so all we're going to need to start with that is going to be using a zip code. For me, I'm going to be using a Cleveland zip code of 44128. I've got a lot of agents in the Cleveland market, so this might be a little bit useful for them if any of them are watching. So type in the zip code that you'd like, and if you're following along with me, if you've got another tab or a browser window open, feel free to type in your own zip code and see what options are available in your area, although I'm sure you're well familiar with those already. On the next screen, we're going to see these are our additional questions about Medicare coverage. So who are you? What is your current status in Medicare? So do you have original Medicare? Are you already on an HMO or a PPO? If you don't have any Medicare coverage yet, or if you don't even know what kind of coverage you have, there's an option for it. To make it simple, let's just say like maybe we're just turning 65, so we don't have any Medicare coverage just yet, and I do not get any extra assistance from the government to pay for prescription drug costs, although those options, again, are there available for you to utilize. Now we'll just click on Continue to Plan Results and see what the Finder has coming out for us. Step 2 of this process is going to be entering your drugs. So all we have to do is type the name of our drug. If you have a good idea of how to spell it or how to kind of sound it out, you might want to just click on the particular letter that corresponds with the beginning letter if you don't know necessarily how to spell it. I've got a list of drugs that are part of like some of the most commonly prescribed drugs for seniors. So let's go ahead and type in a few here. Let's use lisinopril. And as you can see, once you're typing it in, it actually knows, it has their own calculator involved there, so you can see exactly which drugs that they're going to be on. You can even choose the doses, and then you'll add the drug in whatever that particular dose was. So we've added lisinopril. Let's go ahead and add Zoloft as well. Click Find My Drug, and the tablet every month, add that to the dosage. It'll even give you this information on if the drug is a generic or if it's a name brand. So you get to choose your option here. Do you want to use the brand name or do you want to use the lower cost generic? Let's stick with the generic and just kind of continue on adding another one. The only two left that I'm going to be doing is adding Coumadin. And again, add my drug and dosage. It is warfarin. Is going to be the generic, and then we'll add metformin at the very end as well. So we'll find my drug, add drug and dosage, and there we go. So my drug list is complete. Once you're happy with that, all you got to do is click that particular link to continue on and selecting the pharmacies that you want to utilize. So if you want to utilize CVS or Dove's, all you would need to do is click the Add Pharmacy button down there. That'll throw them up top, and then you can continue on to your plan results. On the plan results, before you can actually see the list broken down side by side, it'll give you one last chance to change any of the options that you want. So like I mentioned earlier, there's 38 plans in this particular zip code that are available with Medicare health plans that have drug coverage. Now that's a little bit much for my taste. So I'm not going to utilize that. So what I'm going to try to do is narrow it down a little bit. Say that you're talking to someone that doesn't want to pay a monthly premium. So let's go ahead and limit the monthly premium to under, you can make it 0. But just for the sake of, I don't know how that's necessarily going to react, let's make it $3. You can limit your annual drug deductible to how much they want. Drug options, star ratings, let's say we want at least 4.5 stars. Or even, let's even bring that down to 4 to not exclude everything. And options, and you can even select the plans by company. So let's go ahead and choose and pick a list from the companies that we want. So that's if we know, like let's say we want to offer United Healthcare and Aetna, because we've already done our research, we know that they have $0 plans in this region. But we also want to ask, hey, Mr. Client, what other carriers are you familiar with? Oh, you've always had Blue Cross Blue Shield. You've always used the Anthem products. Okay, great. Well, I'm going to show you a few different options today. So all you got to do is update your plan results. We can see that the first option, Aetna. Since we've already done our research, we can check that off. And we can keep scrolling down to add Anthem, Blue Cross and Blue Shield. And then at the way bottom, we're going to see United Healthcare Community Plans or United Healthcare Walgreens. So you can just click Continue. You'll have 6 plans that are available that fit the area. So we'll put a check by that and continue to plan results. Where we're going to see our original Medicare results. And again, this is just if you are on original Medicare Part A and B. You've got your monthly premium, you've got your estimated annual drug costs, health benefits, everything. And as you scroll down, now you're going to start seeing the $0 premiums that we were discussing before. So we've got the Anthem, we've got Aetna, we've got another Anthem, and Aetna. So it doesn't look like the United Healthcare even pulled up on this page. So if we want to compare, let's say, the Anthem MediBlue Essential with the Aetna Medicare Value Plan, we're going to be able to put the check marks on all of those and be able to do a side-by-side comparison as well. But again, if you want to take a look into the in-depth version of that as well, you can even just click on the name and that'll bring them, and that'll just showcase that one particular plan. But for the sake of comparison, let's go ahead and click that option, and that's going to pull up the Aetna plan and the Anthem plan for you to kind of do a side-by-side comparison. Checking out the star ratings, they both seem very competitive there. The different costs, again, since it's Medicare Advantage, all of these costs are just estimates, so it's not really going to have a true essential bearing because the only thing that you can really predict is going to be the premium because no one's really going to be able to say, hey, I'm going to the doctor. I plan on going or being an inpatient at a hospital 3 times per year. That just doesn't happen unless they're under extreme circumstances. And then you can even check out the health plan benefits. You'll see that these symbols up here are going to let you know if there's dental coverage, vision, hearing coverage. But again, this is all something that you can utilize whilst you're preparing for an appointment, or if you're on an appointment trying to teach all of your clients a little bit about the different plans and how they're comparing and stacking up against each other. Going into the health benefits, going into the annual drug costs, that way you can see the drug deductibles, the premiums, and monthly health plan premium that go along with it. These estimated costs are going to be something that are going to be a little bit more down to earth because if you're selecting the pharmacy that you want, you're selecting the drug plan, you already selected your drugs, this is going to be a more realistic approach to really being able to compare and contrast between all of those drug networks. And that about kind of does it. I always am going to encourage you guys to check out the Medicare.gov website, type in your zip code or type in a client zip code, and just start fooling around. Just start seeing what sort of information is going to be populating. Maybe you'll find a new plan that's available that you didn't know was even there. And then definitely being able to compare these side by side is a great tool and a resource for you to make sure that you're doing everything correctly and making the best tailor-made plan for each of your clients. So I'm just going to go back to the home screen. I already showed you a little bit of the blogs and everything, but just to kind of pull back to another section, you really want to be able to showcase these videos and be able to link to them because they'll pull up either the links to YouTube or you can read more blogs and you can see more videos. And that'll even open you to the entire CMS YouTube website where you can really compare and contrast all the different plans, check out all the videos that they've ever uploaded, which is a great tool and a great resource. And again, I really do encourage all of you to check that out and learn as much as you possibly can and utilize this great tool and resource for yourselves. And so again, that is pretty much it for the live demonstration as well. I want to thank you all very much for coming out today. I know it's a fairly short-ish webinar. I like to keep them pretty quick because I know that you guys have some busy days. If you have questions, I'm going to take a little bit of time and read some of them that have come through so far. But again, thank you so much for sticking with me today. I really appreciate that. There's one question from chat. It says, where can we find the recording of this webinar? All webinar recordings go up usually the next week from when they're recorded. So I know that Melanie just did a dual special needs plan webinar last Thursday. That's already up on our website. If you go to nnfinc.com, it's under the agent resources section. Actually, I can even pull that up here to show you a little bit about that. So let me see. If we go to nnfinc.com, and if this is friendly, it's going to load for me. Maybe. You can go under the agent resources, highlight over webinars, click that, and that's going to lead you to our webinar archive where all of our webinars are going to be available. So this one should be up next week. Another question that we got is, let me see here. What does it mean on Medicare.gov when you know your client is alive and well, the information you entered is correct, they're active in the plan, you sign them up, and Medicare.gov says no info found? That sounds more like you're going to need to confirm that information with the particular carrier, or if you were to call like 1-800-Medicare, they can clear that up. They can clear that information up for you. For information where it's really about, hey, is my client actually covered right now? Do they have coverage? Is there something wrong with my coverage? Medicare.gov is great for just guidelines of how to anticipate Medicare costs and enrollment periods, But if there's something serious that's going on with their health coverage or it's not saying that they have coverage, it's always best to just verify that information with either the carrier or 1-800-MEDICARE. Another question, for a client with neuropathy, not diabetic related, why are orthotics with a script not covered and can it be covered? Again, that's really not a question for this time and for this particular webinar. Maria, if you want to give me a call afterwards, maybe we can start discussing that, and then we can look up some answers for you as well. When picking plans for comparison is another question. Can you, the agent, decide what companies the agent wants to use? So if you're picking the plans for comparison, yeah, because if you're using Medicare.gov and you're getting ready to go on an appointment and you know your market, you know that you've got 3 competitive carriers, UnitedHealthcare, Aetna, and Anthem. And you go to the client's house and you're like, all right, so I'm going to pull up Medicare.gov and I'm going to pre-screen these particular carriers because I know as the agent that all 3 are going to have something that fits your needs. And if you ask that client, hey, what carriers are you most comfortable with? They might just say, I just want UnitedHealthcare. I don't want any other carrier. I just want UnitedHealthcare. Or they might say, well, I'm familiar with UnitedHealthcare, but I wouldn't mind seeing what Aetna has to offer. I wouldn't mind seeing what Humana has to offer. If you wouldn't mind showing that as well, I'd appreciate it. So you really get to be the gatekeeper of that information based on what your client needs and what your client wants. Obviously, again, you don't want to give them too many options because they're just going to get bogged down by all those choices to make that they're just ending up not making any. So this is just a good way that you can really narrow that search and say, here are the options, here are the best fits for you, here are all the benefits, what do you think? And let them pick, let them decide, let them muddle it over and make that decision. And that way you're not going to berate them with an onslaught of too many choices because, again, that's just going to narrow your limitations to be able to make that sale at the table. And I think that about wraps it up for all the questions. Again, I want to thank you all so much for coming out. I love doing these webinars and being able to sit and talk with you. If you have any questions, never hesitate to give any of us a call here at the office. We're more than happy to help support you. You can ask for me or you can ask for any other sales managers from your regions. We'll definitely be able to connect you with someone and hook you up with all of your questions and all of the support that you need. Thank you so much. I really do appreciate it. I hope you guys have a great rest of the day and the afternoon. Hopefully it's warm where you're at, and if not, I hope you stay warm. Take care. Have a good one, everybody. Bye.